Diabetes is a chronic disease which can lead to serious complications. Type 1 and type 2 diabetes, prediabetes, and gestational diabetes affect 1 in 4 Canadians. A recent global survey reveals that Canadians with diabetes fear the serious complications and as a result are not taking their treatments as prescribed by their doctors. Doctors are urging their diabetes patients to develop an action plan to ensure they maintain healthy glucose levels. When blood sugar, also known as glucose, gets low, patients can experience a hypoglycemic event, which can be dangerous in nature and can cause confusion, disorientation, loss of consciousness, seizures, and potentially death. Dr. Vincent Wu, endocrinologist at Health Sciences Centre, outlines why Canadians living with type 2 diabetes are encouraged to work with their healthcare provider to learn how to identify and reduce their risk of hypoglycemia.
Individuals with diabetes often have to monitor their glucose levels quite closely, and it's very difficult to take your shot at the same time every day. If the insulin is mistimed or forgotten, often the glucose levels can fluctuate, and that puts them at risk for either high glucose levels or even low glucose levels or hypoglycemia. We know from surveys that not all patients are forthcoming in reporting their hypoglycemic events. As healthcare providers, we want to get as much information as possible so that we can best suit treatment therapies, including insulin, to a patient's lifestyle. So it's important to get a good history on their day-to-day lives so that we can optimize their care.
In a recent global survey, Global Attitude of Patients and Physicians, or GAP2, more than a quarter of patients surveyed had missed time by more than 2 hours, or reduced doses over a 30-day period. 26% had done so 5 or more times, and 87% had done so intentionally because their blood sugar level was low. The most common reasons for mistiming or reducing doses were low blood sugar levels and attempting to reduce the risk of having a hypoglycemic event. 20% of patients have deliberately not dosed their insulin as prescribed, and 1 in 7 let blood glucose levels go higher to reduce their risk of nocturnal, self-treated hypoglycemia. Mohammed El-Tawil knows firsthand the importance of taking care of himself to avoid hypoglycemia after an event left him unable to move, speak, or even remember his wife of 45 years' name.
Insulin can be complicated at times because if you eat too much or eat too little, you have to adjust your amount. I watch on my meal and I watch on my exercise, and then I can adjust my insulin. Yeah, I worry about experience hypoglycemia because I had it once before, and I measure my sugar before sleep to make sure that I will not fall in it again. Experience when I have hypoglycemia that I was not able to walk, I was not able to talk, I forgot my wife's name, and I felt like I'm a car without gasoline in it. My advice for others living with diabetes is to measure their sugar at least 3 times a day to make sure that they are okay. Do some exercise or walk and eat well.
The signs of a hypoglycemic event include shaking, sweating, weakness or feeling tired, confusion, nervousness, blurred vision, headachy, fast heart rate, hunger, dizziness, numbness, and irritable mood. Hypoglycemic events can be caused by increased physical activity or as a result of missing or delaying meals or not eating at the appropriate time.
People are getting busier and busier these days, and we really need to find flexible insulin regimens